This is the Emergency Medical Minute, sponsored by Health One.
So we have a medical minute on something that we did, I guess, over the last few nights, which is NG tubes. And this is your guys' favorite procedure, right? Oh, yeah. Where we're like, hey, put that NG in that person with a bowel obstruction. So everyone hates it, especially the patients. The reason why is pretty obvious. Like, one of the most sensitive places in your body is the inner aspect of your nose, right? If you've ever, like, even actors who have to, like, cry during scenes, they just, like, oftentimes pull nasal hairs, you know, and then, like, pretend that they're sad about something. But so what can you do to make this procedure better? So what are kind of things that you do in your practice? What?
Lidocaine or viscous lidocaine.
Viscous lidocaine. And how do you put it in the nose?
We'll shove it in there with a Q-tip.
Yeah, so you can do that. Shove it in there with a Q-tip. You can have them inhale it, right, which is Kelsey's doing. So you can do that, and if you leave it there, oftentimes you like have the patient do it, and then they're like, "Okay, are you ready? Great, let's just do this." So then you like shove the NG tube in, and there's actually a better way you can do it, and it's how we deal with nosebleeds. It's pretty similar. Is one, when you kind of go do your assessment, you're obviously looking to see which one of the kind of nares is more open, which one of them that has like smaller turbinates, right? So that's the first step, is look in the nose and pick out which is the better side. Then the second thing is actually, instead of doing like viscous lidocaine, and you can have them start by inhaling it and putting some in, but then actually get a cotton ball and soak it in Afrin and in lidocaine and really shove it back there and tell the patient we're going to be back in 15 minutes. Because then you actually give the patient enough time that they're actually numb. And with the Afrin kind of on a pledge it, just like you do for a nosebleed, it actually helps shrink those turbinates so it's going to pass easier. Okay. So what's the other thing besides kind of that inner nose that makes this so terrible? The gagging. It's actually the tool that we have to kind of put into a patient's nose. And you get this like NG tube, right? And then what comes out, the part that actually goes in the patient is straight. So what you have to do is you actually pass it through. You're trying to angle it down, but then it hits the back of your oropharynx, and then you have to bludgeon it or ramrod it and hope that it's bending downwards, right? It's really a stupid procedure. And the tools we have to do it are really actually pretty bad. So there's a way you can actually get that to be more ergonomic for the patient, to not just be straight, but to actually have a bend. And you want it to look almost like a little bit of like a 70-degree bend, or, you know, where kind of when you put it in, you can actually just do this, and it's naturally going to bend down, and it doesn't have to ramrod against the end and then hopefully bend down. So does anyone know how to do that? Not hot water. Hot water is actually your enemy, right? So you actually have to shape it, and then you have to put cold water in it because it's plastic, right? So any type of plastic, it gets, just like metals, they get more rigid when you actually get colder, and then the elasticity improves actually as you actually get warmer, right? So one of the things you can do is you can take an ET tube stylet, you get your NG tube, you take it out of the packaging, you bend your stylet to the shape that you want it in, and then you tape your NG tube to it so it has that shape, and then you get a basin full of ice water and you just leave it there. So what I often do, and we had this, I think, a night or two ago, is a really difficult patient, didn't tolerate the first NG tube, was trying to hit nurses because he was a little bit elderly and, you know, a little bit, just out of it, too, from the Phenergan. Is we actually did this, and he tolerated the second NG better because it was just, you know, one, he was number, two, the tube wasn't hitting the back of his oropharynx. I mean, he was still miserable, right? Because the last piece that you really can't do anything about is once that thing's passing through here and you're trying to get it into the stomach, that's a really bad feeling, but it's not as bad as kind of the first two, the nares, and then trying to get it to make the turn. So, NG tube. Thank you.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.